Hey, it's Chris McGee with Mac Media TV, and today I'm excited because I have a guest on the show that's been on a couple other times. We've talked about dry eye, and we've talked about some cosmetic procedures. Today we're talking about the best LASIK surgeons in the Boston area, and I'm pleased to have Dr. Jean Keamy from the Keamy Eye and Laser Center with us. Dr. Keamy, how are you?
I'm great. Thanks for having me today, Chris.
Thanks for coming back on. I appreciate it. This is a kind of a big topic. I know it's personal to me, and we're all inundated with this, especially with LASIK surgery. There's so much advertising, whether we're on Facebook, we're getting the ads in our news feed, or the billboards or the radio. $9.95 an eye, $7.97 an eye. Can you help us out a bit? I mean, it seems to be like there's a little bit of hype in the market, and we're talking about our site. What should we be looking for when we're looking for LASIK surgery? And then talk to us a little bit about all of this. I know it's very competitive, but talk to us a little bit about what really should be, what really the price point should be is probably what I'm trying to ask.
Okay. Well, with all that advertising and promotions, it's making your, eye surgery a commodity, which it's not. So one of the things that you really want to look for is what are you getting for that? If you just want to never really know your surgeon, and they sometimes are called cutters, they come in, they do the surgery, they cut the flap zap, and then you really don't have much interaction with the surgeon. Those are usually the types of places that are advertising the very, very low prices. But if you want to have more of it is a premium surgery, have a relationship with your surgeon, have input from your surgeon before the surgery, after the surgery, as well as all your follow-up care with the surgeon, so that if something does go wrong, you know who can fix it. That's what you're paying for at premium locations.
Okay, go ahead. I'm sorry, I didn't mean to interrupt.
Well, and also, really, not everyone is a LASIK candidate. I find a lot of people come to me as a second opinion. Oh, I was told I was a LASIK candidate at my last consult, and they're really, truly not. Maybe they have terrible dry eyes, or they have an early cataract, or no one ever explained to them that if they're in the age group that needs reading glasses, that they're not going to be able to lose their glasses for all tasks. So the surgery is really a customized procedure and should be treated that way, and it's really disappointing that it's being treated like a commodity in many markets.
Well, I really appreciate that. That not everybody's a LASIK surgeon, because I just heard an ad on the radio this last weekend saying everybody is a candidate for LASIK surgery. So to meet with the doctor and to make sure that you really are a candidate, and to make sure you're meeting with the doctors, correct? Is that what I'm getting?
That's correct. I mean, a lot of places somebody else is doing the screening. A lot of people don't meet the surgeon until the day of surgery, which for me wouldn't work if I was the patient, but you do pay for what you get. So if you're paying, it's in the Boston market, surgery ranges for a few $1,000s per eye is standard. So you're paying for that specialized care and attention from the surgeon. Well,
this is your eyesight. I mean, cutting corners when we're talking about our health is kind of a crazy deal. That's why it kind of gets me when we start to get that whole competition on price and inundated. So what you explained it there a little bit, but tell us what makes Keamy Eye and Laser different and not a commodity like you were talking about, that all of this advertising is making eye surgery.
Well, at the very first appointment, you meet me, the surgeon, and I do my evaluation and go over your options and tell you why you are not a good candidate or not a good candidate for LASIK. And then I talk about the finer details about sometimes monovision is an option. I might explain why we're going to make one eye for distance and one eye for near because you're 50 years old and otherwise you'll need reading glasses. and we'll do a trial of that monovision in contacts or glasses so that you can have a preview for what the surgery outcome will be like. Not a lot of places do that. It's very time-consuming. A typical LASIK consult in our center lasts for 2 hours.
Wow.
Not a quick consultation. And all the risks and benefits of the surgery are discussed. We analyze whether you are a candidate or not. And then when you do the surgery, I'm the person doing the surgery. And then after the surgery, I'm the doctor that you see following the surgery.
So very custom. I mean, you're talking about to the point to where there are options that for us like me, when I had my LASIK done, it's been quite a while now, and very happy with the results. But the one thing that I was told when I went in there is I would always need reading glasses because I was 45 when I got it done. But you're saying that had I sat down and really gone through a custom consult like that, there might have been options to do mono. Cool, cool, awesome to know. And we're seeing you. So I mean, it's you from the beginning, it's you at the end. So there's no, we're not seeing a nurse or anybody else. It's just you.
That's correct. I have an assistant, but I come in. They may help me, you know, check your vision and get you ready. But you're always seeing me.
Well, yeah, absolutely. I understand that you probably have your assistants in there. So a 2-hour consult. So people need to set that aside. This is serious stuff. We're talking about your eye and talking about actually increased enjoyment of life. So it's worth the 2-hour investment of your time. What's required of somebody if they to set up something like that?
Well, you have to be prepared that you're going to be there for 2 hours. We will want to dilate your eyes so that we can look at the back and make sure that you have no glaucoma, no retinal problems, make sure you have no cataracts, which are all can sometimes be a contraindication to surgery. And we'll do a series of measurements of the shape of your cornea. You also need to stay out of your contacts for 10 days prior to the consultation. You need to bring a driver with you if you've never been dilated before and are unsure about driving with your pupils very large. You also need to bring sunglasses. Okay,
so you need to be prepared when you're coming in. So people can just give you guys a call or go to See Me Dr. Keamy and book an appointment there.
That's correct.
Okay, and then do you offer, if somebody sees this video, do you want to offer them anything? They mentioned, hey, I saw you on this video interview online. Do you want to offer anybody anything special? I'm putting you on the spot, by the way.
No, that's fine. We can offer $100 off per eye if you sign up for surgery.
Awesome. Well, you got that here. Thank you, Dr. Keamy. I didn't mean to put you on the spot, but I asked that of all my guests. So just seemedrkeamy.com, Keamy Eye and Laser Center. What's the phone number?
508-836-UC, like USEE, or 508-836-8733.
Awesome. Okay, thanks for coming on again, Dr. Keamy. We're going to talk about, I think we're having you on again and talk about cataract surgery, correct?
Yes.
Okay. Have a great afternoon. Thanks for coming on and spending some time with us. And thanks for watching, everybody. Have an awesome day.
Thank you.